Hi, my name is Alicia Reynolds, and I'm giving an informative speech on the golden hour after birth. And this is my audience, all 8 of them. Oops. Okay. All right. According to Dr. Raylene Phillips, in an article on Medscape, there is good evidence that normal-term newborns who are placed skin to skin with their mothers immediately after birth make the transition from fetal to newborn life with greater respiratory, temperature, and glucose stability, and significantly less crying, indicating decreased newborn stress. Dr. Raylene Phillips stated, "Mothers who hold their newborns skin to skin after birth have increased maternal behaviors, show more confidence in caring for their babies, and breastfeed for longer durations." Dr. Raylene Phillips stated, "Being skin to skin with the mother protects the newborn from the well-documented negative effects of separation, supports optimal brain development, and facilitates attachment, which promotes the infant's self-regulation over time. I work in labor and delivery, and I get to experience firsthand the importance and amazing health benefits of skin-to-skin contact between mother and baby after birth. During my presentation, I hope to inform you about the health benefits and importance of mother-child bonding for the first hour after birth. To begin, let's focus on the benefits of skin-to-skin contact for the newborn. The manner in which the newborn is welcomed into the world during the first hours after birth may have short and long-term consequences. There is good evidence that normal-term newborns who are placed skin-to-skin with their mothers immediately after birth makes the transition from fetal to newborn life with greater respiratory, temperature, and glucose stability, and significantly less crying. Mothers who hold their newborns skin-to-skin have increased maternal behaviors that show more confidence in caring for their babies and breastfeed for longer durations. Skin-to-skin contact is really how the newborn begins to adapt to their new environment. Skin-to-skin also calms the newborn and promotes the important process of positive bonding between mother and the newborn. There are 9 instinctive stages that the baby goes through during the first hour after birth. The mother can be more aware of these stages and meeting the baby's needs when skin to skin with the baby. I have these 9 instinctive stages after birth. The first stage is the birth cry. The second is relaxation. The third is awakening. The fourth is activity. The fifth is rest. 6 is crawling. 7 is becoming familiar with their surroundings. 8 is suckling, and 9 is sleep. Early skin-to-skin contact helps to promote successful breastfeeding since babies are ready to breastfeed immediately after birth. According to the American Academy of Pediatrics, breastfeeding within the first hour allows the infant to receive the benefits of colostrum, which is the first step to completing a baby's developing immune system. According to WebMD, a WebMD article on the benefits of breastfeeding, breastfeeding decreases ear infections, asthma, diabetes, childhood leukemia, and SIDS in an infant. Skin-to-skin also promotes optimal brain growth for the baby. According to Dr. Alan Score, a neurobiologist from UCLA, skin-to-skin contact activates the brain through the prefrontal orbital pathway and contributes to the maturing brain. Dr. James Prescott, a neuropsychologist and health scientist administrator of the National Institute of Child Health and Human Development, found that touch and motion are the most important senses for normal brain development. I'd now like to talk about the health benefits of skin-to-skin for the mother. Giving birth generates changes in a woman's brain chemistry that increase the desire to nurture. According to Dr. Raylene Phillips, skin-to-skin contact and the baby suckling at the breast releases a hormone that helps the mother to connect to the child and causes the uterus to contract and stop bleeding. Oxytocin is a hormone that is released into the bloodstream. It helps with birth, bonding with the baby, and milk production. It has been studied in relationship to attachment. Research has shown that skin-to-skin contact and nursing within the first hour will help the mother continue to breastfeed longer. According to a pediatrician, Dr. Sears, breastfeeding lowers the mother's risk for certain diseases such as breast cancer, ovarian cancer, diabetes, postpartum depression, rheumatoid arthritis, and a cardiovascular disease including high blood pressure and high cholesterol. Breastfeeding also helps the mother burn calories and return to pre-baby weight faster. According to an article on Medscape, studies done on a mother who has had at least brief skin-to-skin contact with their infants were more confident and more comfortable handling and caring for their babies than mothers who had no skin-to-skin contact at all. I would now like to talk about skin-to-skin contact after a C-section, a cesarean section. Skin-to-skin contact after a C-section is a new practice that very few hospitals have extended to their operating rooms. According to the CDC, 32.2% of all U.S. deliveries are by C-section, and according to the CDC, only 32% of U.S. hospitals implement skin-to-skin care for women and babies within 2 hours of an uncomplicated cesarean birth. In order for skin-to-skin contact in the OR to take place, all involved staff must feel comfortable with it. All doctors involved must be assured that the safety and well-being of mothers and babies will always be the first priority. Knowing that they will have immediate veto power if any concerns arise goes a long way towards reducing anxiety about beginning the practice of placing babies skin to skin in the OR. According to an article on Medscape, studies have shown that because mothers are so focused on their new baby during skin to skin in the operating room, that their perception of pain is often diminished. The routine standard of care after a C-section can be up to 2 hours that the mother and the newborn are separated. Danny Michaels, a labor and delivery nurse, described the standard of care after a C-section. The standard of care for a newborn is to be taken to a warmer where the baby is examined, cleaned, weighed, measured, and swaddled. The father then takes the baby to the nursery while the mother finishes the recovery process. The Academy of Breastfeeding Medicine protocol from 2008 states that the healthy newborn can be given directly to the mother for skin-to-skin contact until the first feeding is accomplished. This wraps up my presentation on the golden hour after birth and why skin-to-skin contact is so beneficial for mother and baby. I have shared with you the benefits that uninterrupted skin-to-skin contact has immediately after birth for mother and baby. The golden hour is a once-in-a-lifetime opportunity when baby meets parents for the first time and a family is formed. The sacred time should be honored, cherished, and protected.